Hello, good morning. Myself Dr. Ravina Kalyan, Faculty of Physiotherapy Department. Welcome to our YouTube channel RPIIT Academics. If you like the content of this channel, please do not forget to subscribe and share the content. So in this presentation, we'll talk about the condition that is respiratory failure. So the term respiratory failure is used when pulmonary gas exchange fails to maintain normal arterial oxygen and carbon dioxide levels. And respiratory failures can be divided into two ways, that is failure of oxygen resulting in partial pressure of O2, that is PaO2 is less than 8.0 kilopascal, and failure of ventilation resulting in partial pressure of CO2 is more than 6.7 kilopascals with accompanying acid base changes. So the causes of respiratory failure is airway obstruction, that is limits airflow and thus reduce airway ventilation. It can be upper airway obstruction or lower airway obstruction. So upper airway obstruction include obstructed sleep apnea, stroma, angioedema, Stevens-Johnson syndrome, inhaled foreign body, acute epiglottitis, and the lower airway obstruction includes COPD, asthma, bronchitis, cystic fibrosis, bronchiolitis obliterans, and disorders of the lung parenchyma. And the acute condition that result in the respiratory failures are acute respiratory distress syndrome, pneumonia, acute pulmonary edema, acute pulmonary embolism, acute fibrosing alveolitis, and severe ARDS, that is acute respiratory distress syndrome. And the chronic condition that result in respiratory failure are chronic fibrosing alveolitis, pneumoconitis, sarcoidosis, and the disorders of respiratory muscle pump are neurological brainstem disease, amyotrophic lateral sclerosis, and over sedation. Others are post poliomyelitis syndrome, Guillain-Barré syndrome, central sleep apnea, cervical cord trauma, congenital myopathy, and chest wall trauma. Thank you.